so we can start. Thank you.
Great. Welcome, everyone, to the Climate Change and Health webinar series. So today's webinar is on applying behavioral science to climate adaptation and water security, which has impacts for human health. Our speakers today are Julie Truelove from WaterAid Canada and Dr. Rohit Ramchandani from the United Nations University Institute for Water, Environment and Health, which is based in Hamilton, Ontario in Canada. Next slide, Julie. So some housekeeping points before we start. The webinar is presented in English and is being recorded. Please stay muted unless you're invited to speak. Use the chat for questions. Feel free to write questions in English or French. And some resources will be shared in the chat during the webinar. Quelques points logistiques avant de commencer. Le webinaire est présenté en anglais et en cours d'enregistrement. Veuillez rester en mode silencieux à moins d'être invité à prendre la parole. Utilisez le chat pour les questions. N'hésitez pas à écrire vos questions en anglais ou en français. Nous ferons de notre mieux pour traduire pour les présentateurs. Des ressources seront partagées dans le chat pendant le webinaire. Pour obtenir des sous-titres en français, trouvez sous-titres ou captions dans le menu en bas. Activez la traduction, translation, pour la langue de mes sous-titres, My Caption Language, sélectionnez le français. Cliquez sur Paramètres de sous-titres ou Caption Settings pour plus d'options. Et je vais mettre ces instructions dans le chat en un moment. Next, Julie. These webinars are organized by the Climate Change and Health Working Group of the Canadian Association for Global Health, CAGH. Ces webinaires sont organisés par le groupe de travail sur les changements climatiques et la santé de l'Association canadienne pour la santé mondiale, l'ACSM. Next. Individuals and organizations anywhere in the world who are interested in global health can become members of CAGH. And CAGH members are welcome to join the Climate Change and Health Working Group. Des individus et des organisations partout dans le monde qui s'intéressent à la santé mondiale peuvent devenir membres de l'ACSM. Et les membres de l'ACSM sont les bienvenus pour se joindre au groupe de travail sur le changement climatique et la santé. Next. And now, please welcome our speakers. Veuillez accueillir Julie Truelove and Dr. Rohit Ramchandani. Over to you, Julie.
Thanks, Sarah. Thanks very much, everyone. And thanks for the invitation to present to you about the BASIN project. I'll dive right in. We have quite a few slides and information that we want to share with you. So if you're not familiar with WaterAid, this is a slide about WaterAid Canada. WaterAid Canada is the Canadian member of the WaterAid Global Federation, and our vision is really for everyone everywhere to have sustainable and safe water, sanitation, and hygiene. We have 4 global strategic aims around achieving universal, sustainable, safe wash services, prioritizing wash across the health sector, strengthening climate resilience of wash, and increasing quantity and quality of financing. And here in Canada as well, we work across 4 pillars of inspire, enable, empower, and influence in how we do our work across programs and policy. The BASIN project, there's 3 lead partners in BASIN, WaterAid Canada, Water Witness International, and the London School of Economics Grantham Research Institute. UNU-INWEH is our Canadian partner alongside the rest of the consortium. And the budget for WaterAid and INWEH is 2.48 million Canadian dollars, and the total BASIN budget is 8 million Canadian. The project is running from April of 2023 through to the end of 2026, and the countries of focus are Burkina Faso, Malawi, and Tanzania, with WaterAid primarily working in Burkina and Tanzania. There's interest also for scaling the findings and see if they're applicable in other settings in Ethiopia, Zambia, and more widely in the Sahel region. This is a longer list of our consortium partners. We're a big group. When we're all together, there's a mix of academic and NGO partners, along with a knowledge broker in CLIMA, Integrated Development Solutions, as well. And importantly, the funding for BASIN comes from the CLARE program, which is Climate Adaptation and Resilience. And it's a flagship research program on climate adaptation and resilience that's funded primarily by the UKAID, UK FCDO, and co-funded and hosted with IDRC here in Canada. And so it's really looking at bridging gaps between science and action and Southern-led leadership and research for socially inclusive and sustainable action for climate resilience and natural hazards. So there's more at the link if you want to learn more about the CLARE program. We are just one of about 34 consortiums now that are within the CLARE program. And within CLARE, the three pillars in the middle, that's the three pillars of the research themes: risk-informed early action, developing in a changing climate, and understanding climate risks. And BASIN is primarily on developing in a changing climate, but we do touch on the other pillars as well. So the objective in BASIN is really to demonstrate behavioral and psychological sciences to enhance inclusive water security for climate resilience in sub-Saharan Africa. Part of it is also we really want to strengthen capacity to apply behavioral approaches and to support people to adapt more effectively in a changing climate. Part of what we're doing is really looking at new ways to conceptualize the role of behavioral research in water security. We're looking to enhance the capability and capacity to apply behavioral approaches. The models in behavior science are largely untested in sub-Saharan Africa. They're mostly grounded in Western science and Western applications. So it's really looking at how can we take what's already there and strengthen it in the context in which we're researching. The next two circles are really important for WaterAid because we focus on research into use. So it's applying co-designed and impact-focused research to identify and test behavioral determinants and the levers at local level all the way to national levels, and potentially some for global, but we're mostly to the national level. And this evidence-informed programmatic interventions to enhance water security and inclusion related to climate resilience. So there's a lot that's encompassed under what we're trying to do, both in what we're doing, but also how we're doing it as a research consortium. And so before I move too much further, there's a couple of definitions that I just wanted to flag. So they're consistent across the conversation. And so when we talk about WASH, we're talking about water, sanitation, and hygiene for basic human needs. And that's really this foundation of public health that I think we've known for centuries now, I think. And when you look at that circle diagram, basic human needs is that center of the circle. And then when we talk about climate resilient WASH, we often say climate resilient WASH is just good WASH. And we sort of stand by that in terms of what can we do in WASH systems and system strengthening that can make WASH services and infrastructure more resilient to climate change, be able to respond to shocks and weather-related events and so forth. And so there is a newish definition that's been agreed through the Sanitation and Water for All partnership, and then WaterAid also aligns with that. And we've had our own definitions around this that we've been working towards over the last couple of years. Then when we get to water security, it's the wider circle. So it encompasses a wider watershed level or basin level of what's happening on water resources around agriculture, environment, industry, energy, and all the uses of water in a given context, including WASH. And so that is the much wider picture that bridges across WASH for basic human needs and also the water resource management issues of a given area. So it's a much wider discussion. And then when we come to behavior theory, so really behavior theory is like looking to explain human behaviors in a scientific study and observation. It's identifying patterns and connections and the determinants of behaviors and what may or may not work to change those behaviors. It provides models and frameworks to systematically design interventions and implement and evaluate behavior change. And so in BASIN, you'll hear more about the COM-B model, and this is speaking to capability, opportunity, and motivation. And there's a behavior change wheel that you'll see that helps to map that out. But also central to this is the behavior-centered design, or BCD model. WaterAid has used BCD for many years in its hygiene behavior change work. And so now we're at this point where we're trying to sort of distinguish hygiene behavior change from behavior science in WaterAid. And how do we then apply the behavior science models in other ways, in this case, to climate adaptation? And so we're taking what we've learned, but applying it in a different way. So in BASIN, there is 5 core research questions that are largely centered around sustaining engagement of community champions for climate and water, and uptake and use of climate information. And so these are all very interconnected in how we're talking about water security and WASH and the behaviors and practices that influence climate resilience. The 6th question that you see there is an organizational case study of WaterAid that's being used as part of the research to look at more organizational change. And where and how did WaterAid make this shift towards working on climate resilience? Because it wasn't always the case. WASH and water security has always been part of climate resilience, but we have not always framed it as such. And so we're working with a PhD student at London School of Economics who is looking at this from an organizational change perspective as well. So we'll move now to some of the case studies. So there is, I think there's 11 case studies across BASIN now, and there's 2 in Burkina Faso with WaterAid. And so one of the case studies, it really integrates both of them, I guess, but the first case study that we'll talk about is focused on the sustaining water resources approach. And so this is an approach Dr. Lucien Damiba, who's now the country director for WaterAid Burkina Faso, he's been working on this through his own studies and his work for almost 12 years now. And so it's really demonstrating locally led adaptation for water security in practice. And so central to this approach is volunteer champions. In Burkina Faso, they refer to them as relays, and they're acting as local water monitors. And so the champions will track the rainfall as part of the local climate information, and this will be used to inform farmers and community members. But then it's the uptake and use of that information that we're trying to dive into in terms of what is it that farmers can do with it? Do people know what to do with the information? Do they have the means to adapt based on the information that they're receiving? And so in this example, the adaptation behavior is often that farmers are then changing the timing of when they seed crops, which is also then affecting the harvesting time, but it's also adapting to the changing rainfall patterns. And so that's just one example of what an adaptation behavior could be. So it's defining those behaviors that influence the uptake and use of climate information. And this goes from local all the way to some work with the National Meteorological Agency. And then also importantly, the sustaining engagement of the climate champions or relays. And I just want to also credit Jabril Berry, who is our project lead in Burkina Faso as well. Now, this one has a ton of information on it, but this is an example of that COM-B model of how we're mapping some of the capability, opportunities, and motivations across these 2 questions around engagement of the community relays, and then also the perception and use of climate information. So once we have this level of data collected, then the next stage is this co-design process of intervention packages for behavior change, which we'll see in a second from Tanzania. Similar to that one, this is my colleague Chris Lalika in Tanzania. He's the BASIN project lead. This is Lake Basutu in the photo on the left. And then he's mapped similarly the different opportunities, motivations, and capabilities. Some of it is down to physical capabilities of what tools are available, and also, again, those motivations, the perceptions in the community that affects motivation. Are they trusted? And things like that. And so then we take all of that information, and this is where we start to design, co-design really with all the stakeholders, the different behavior change packages. And so it looks at what's the activity, what behavior are we targeting, and what's it meant to change, the motivational message that we're trying to reach, what makes the old motivation message and then the new motivation and new messaging. What are the triggers from the motivations in the behavior-centered design model? And then what benefit does it offer to the audience? And so importantly for this conversation, one of the activities around Lake Basutu is a training package for community health workers. And so the behavior we're meant to change is, okay, how do we reduce health risks from unsafe water use? And what makes this motivational is we're leveraging the trusted relationship of the community health workers. And the old script is, health is separate from the environment, whereas the new message is, healthy lake, healthy people. And so that's really driving some motivational factors from nurturing and justice related perspectives. And it's really intended to protect health and reduce disease risks and create a safer community through actions around the environment and the lake. So again, how do we bring this all together from a health lens? We know this experience of WaterAid WASH as a foundation of public health. Hygiene behavior change is very central to that. We know that when quantity and quality of water supplies are reduced, this can inhibit hygiene behaviors. And so there's an increased risk of water-related disease transmission, outbreaks such as cholera. So really, what can we learn from this, again, this distinguishing behavior science from hygiene and apply it towards climate adaptation behaviors? So we do see a link to the community health worker model. There's a lot we can learn from the community health worker model and how we could apply it to the community champions. We're also looking a lot at the One Health approach over the last several years, and how do we strengthen the environmental health pillar of One Health, which tends to lag behind. So we see water security and climate adaptation measures really as central to this, and understanding those behavioral determinants across the environment, animal, and human health pillars can really contribute to operationalizing a One Health approach. And again, I think that line about healthy lake, healthy people really says it all in the bigger picture of how we want to frame this from Lake Basutu, but then how to make it a reality as part of practices around water resource management. So again, research for impact. We've looked at, we're heavy into research for impact right now and determining these different impact pathways. And we definitely envision some potential pathways for climate and health as we go forward. Just a few thoughts and ideas here that we've put together is, we know that there's the COP30 Bellum Health Action Plan, and we input to that consultation through the ATASH, the Alliance for Transformation on Health and Climate. I can't quite recall the acronym ATASH, but we've input to the consultation there in the lead up to COP. We want to bring the behavioral lens and then the findings into some of the definitions and criteria for climate resilient WASH for WaterAid, but also beyond. We know the Green Climate Fund, for example, has water and sanitation guidelines. So what benefit could there be to embedding the behavior lens into guidance like that where they don't exist? We want to embed the behaviors again in different indicators for climate resilient WASH. The Joint Monitoring Program, which is the standard for measuring water and sanitation and WASH and healthcare facilities coverage. There's potential applications with their new indicators as well. strengthening the behavior lens of nature-based solutions and locally led adaptation principles, I think is quite key to environmental health and how we move that forward. There's lots of learnings as well around from Indigenous and traditional knowledge, and there's insights from the Barbeg people around Lake Basutu, around their beliefs around the lake, and what sort of acts as a motivation, but also maybe inhibits actions around the lake in protecting it for the future as well. Farming practices and behaviors have really emerged across many of the case studies, which links very closely, of course, with food security and nutrition. And so we really want to unpack that further in terms of how is that impacting livelihoods and the gendered social norms around water protection and domestic water resource management. And lastly, too, there's this loop that seems to be emerging around the relationship of, we're hearing feedback that the health status of champions can impact their capability to fulfill their roles as champions and making their ability to adapt to climate change. And yet climate impacts are already being felt through water insecurity and impacting health status, such as the prevalence of cholera outbreaks and other day-to-day issues. So there's a loop that needs to be unpacked there in terms of how it's affecting people's health status, but also their roles as community champions as well. So I'm going to stop there. There's a few more resources linked on this slide for your interest in reading. And this is a photo from the recent co-design workshop that was taking place in Burkina Faso with a lot of people from the water agencies and WaterAid and community leaders and authorities as well. So thanks very much. And with that, I'm going to pause my slides and get Rohit's slides going and pass over to you. Thanks.
Thank you so much, Julie.
Thanks, Julie. I tried putting the links into the chat, but they didn't come as links, so I apologize to everyone for that. We'll get you to the links later. And then there was one question actually, Julie, about community health workers. I don't know if you wanted to answer that just as we get set up for Rohit. Are community health workers also being considered to step into the role of community climate change champions? So it's great that we are leveraging the CHW model, and maybe the trust-based relationships they have built could also be leveraged where possible. And then that may also continue to strengthen the climate change and health linkages.
I think it's a really good point, and I don't think we've gotten to the level of how we're going to put it into practice. But I think when you look at the community champions, they tend to be people that are very involved in their community. They're very self-motivated to be part of different groups, and so absolutely, I think this speaks to also, Sarah, to the other COHERS project as well, in terms of the community One Health teams and how we're bringing people together. And so I think definitely we would like to look at this in terms of how we leverage the relationship with the CHWs, but also make sure that they're bringing the same water security environment messages into their work day to day as well. So thanks for the question. Yes, definitely.
Great, thanks. We'll pass over to Rohit. There's another question, but we will have more time for questions after the next presentation, so we'll bring those up later.
Let me start by providing a little bit of an overview of UNU-INWEH. So the United Nations University is the academic and research arm of the UN system. We're actively working with a diverse range of stakeholders from scientific communities, universities and research institutions, as well as UN member states and the UN system more broadly. We're made up of 13 institutions worldwide with headquarters in Tokyo, Japan. UNU is led by a rector who holds the rank of Under Secretary General. And we're really trying to address the grand challenges of the 193 UN member states by bridging the best evidence from the international academic community with the needs of our member states. 13 institutions have different areas of focus across the SDGs, and the Institute for Water, Environment and Health has been hosted by Canada since 1996. A lot of people don't know that. We were based out of McMaster University, and so we're based in Hamilton until last year. But last year, UNU-INWEH actually transitioned over to the city of Richmond Hill. So we're now based out of the GTA. And UNU-INWEH is essentially the UN's dedicated think tank on water-related issues. Although we focus more broadly on water, environment, and health, often with water kind of serving as a pathway to discussing many of the other SDGs, right? So whether you want to talk about energy, whether you want to talk about health, whether you want to talk about peace, water is a pathway to have many of those discussions around the Sustainable Development Goals. There are 3 pillars of focus within UNU-INWEH: research and innovation, education and capacity building, and policy impact and advocacy. And so the focus that we have as a partner within the BASIN consortium is actually related to education and capacity building. And that is through a focused effort on developing a water and behavioral sciences program. And so this is being led by myself in collaboration with my colleagues, Dr. Abraham Nanbogu and Professor Grace Alusanya. And so the water and behavioral science program is really a co-designed program. We're building on the case studies from BASIN, and essentially kind of bringing those lessons and those case studies into the course, while also really providing a practical approach to what is called behavior-centered design. The course has, or the program has 3 courses. The first provides the foundations of behavioral science for water security. Course 2 then looks at the first 2 phases of what is a 5-step framework for behavior-centered design, or the application of behavioral sciences. So that 5-step process is from the World Health Organization, and covers the first stage being define, where you're really looking to clearly define a problem in terms of behaviors. Then moving to behavioral diagnosis and specification. And so course 2 covers these first 2 phases of the behavior-centered design process. So we cover themes like systems thinking, stakeholder analysis, as tools for better defining our problems and diagnosing them. We look at evidence reviews, in-context consultation and co-design with end users, and then really getting into the details around what it means to do behavior specification, prioritization, and diagnosis. And that covers various methods like behavior mapping, systems mapping, different types of methodologies for working with end users, community-centered design, and the like. Course 3 then moves into the 3rd, 4th, and 5th bubbles that you see here. So number 3 is moving into the design phase, and that really looks at the strategy to influence behaviors based on reviews of the evidence, based on an understanding of what has been tried before, what's worked, what hasn't, and then really co-designing interventions with a systems perspective in mind. Implementation then, and so we cover basics around project management, as well as planning for performance measurement. And then the final stage is around evaluation. And so we're really looking at monitoring and evaluation specifically for behavior science, adaptation, and refinement. And then, of course, when warranted and when the evidence suggests that this is something that can be scaled, how to effectively go about doing that. So the BASIN case studies from Burkina Faso and Malawi and Tanzania, they're don't have as much of a health focus, and these have, again, going through this behavior-centered design process, the types of water security challenges that emerged and were identified by communities just happen not to have direct health kind of areas of focus. So what I want to do to kind of connect it to the global health audience is really look at what some of those intersections are when we think about this kind of water, climate, and health nexus. You really can't talk about climate change without really understanding water. Water is where climate change is first felt, and where we can really see the impacts of climate change taking place. And that climate water health nexus, presents a number of challenges within our sector. And so just to give an example of some of those key intersections, we could look at wash and menstrual hygiene, where water scarcity is really disrupting hygiene and increasing infection risks. That lack of access to clean, safe water. We still have over 2 billion people globally without access to clean water. That has implications for girls attending school, opportunity costs from a livelihood and an education standpoint. We can look at drought and food security as well. Another kind of key area. 90% of water use globally is in the agricultural sector. And so when countries are facing water scarcity challenges, that has major implications when it comes to nutrition, malnutrition. And so reduced water for agriculture really drives some of these food-related challenges. Another area is around, we move from droughts, but we're also seeing an increasing number of flooding events globally. These extreme weather events are kind of increasing at a very rapid rate. So with flooding comes an increase in waterborne diseases as well. So floods contaminate water. We see an increased spread of diseases, diarrhea and cholera. Flooding events will kind of get into latrines and you have overflows, and then you have waste kind of mixing into the environment, and so just increasing exposure opportunities. Vector-borne diseases as well, so we're seeing changing water patterns that are altering mosquito and other vector habitats. And so, Julie talked a little bit about One Health, and these are some of the areas where bringing a One Health lens is really contributing to the research right now on understanding these interlinkages between climate, food, or animals, environment, and people. When we think about water quality and dehydration as well, polluted sources and heat are increasing illness and dehydration. We're seeing agricultural runoff and contamination of water sources as a challenge. Whether that's exposure to things like arsenic or other chemical pollutants, that's another kind of key area that we're looking at from a health and water standpoint. Displacement and migration, sea level rises and shortages are forcing population movements, right? So we're seeing sea levels rise, we're seeing salination of soil. As a result, that's affecting food. And then as a result, we're also seeing migration of populations away from those areas. Small island states is an area where the Lancet has recently also just done a focused publication series. Then finally, just mental health and urban spaces and really the link with water and climate stress and anxiety. This is something we're also seeing increasing significantly, particularly within populations like within youth populations. We're seeing a high degree of climate anxiety. And water insecurity is really harming well-being in a number of ways. We also know that blue spaces and green spaces have a major impact on improved health and well-being and positive kind of mental health benefits. So just to kind of give a sense of some of these key intersections. This is a text-heavy slide, but what I really wanted to do here, the Lancet recently released its climate and health countdown. What I've done here is just pulled the references from this very recent publication. It was published in October. I would encourage you to check it out if you haven't seen it yet. But there are a number of references to water. And so just to kind of give some examples. So in 2022, 45% of the global population were highly vulnerable to climate change with increasing exposure to water insecurity, heat waves, and food shortages. And so, water insecurity is really recognized as a core component of climate vulnerability, and that's affecting nearly half of humanity. Droughts in 2023 contributed to widespread water scarcity, compounding food insecurity, and limiting hygiene. Water-related vector-borne diseases, including cholera and malaria, saw climate-induced increases in transmission suitability. Rising sea levels, saltwater intrusion, and flooding events, also compromising access to potable water in coastal areas. Interruption of clean water supply following disasters remains a leading cause of post-disaster mortality in low-resource settings as well. Finally, I'll just jump to that last one there. Only 34% of countries had climate health adaptation plans that integrated water safety and access planning. And so there's a major gap there that presents an opportunity, for kind of transdisciplinary solutions. What I want to do just to kind of end off here is really look at one particular health application where we applied a behavior-centered design approach. And really, this is a case study based on my dissertation work in Zambia. Some of you might be familiar with the Life case study that really looked at how we could transform access to ORS and zinc for childhood diarrhea. Diarrhea, of course, being the leading cause of morbidity and mortality, waterborne cause of morbidity and mortality, and the Life case study over a decade, over a 10-year period, really moved through those 5 stages of the behavior-centered design process. And so just to kind of give that kind of an end-to-end example and really bring some of the health applications to life when we look at the application of behavior-centered design, that's what I'll end with here. So the first phase for us was really looking at defining the challenge. And from a diarrhea standpoint in Zambia, we saw that ORS and zinc, we know that these are two medicines that are very effective against diarrhea, morbidity, and mortality, both in home and community settings. However, access to these two medicines was very limited. In fact, when we started our work, less than 1% of children with diarrhea in the previous 2 weeks, and this is a global statistic, but certainly the case in Zambia as well, less than 1% coverage of the combination therapy of ORS and zinc, with the limiting factor really being zinc. So ORS generally globally at that point was 60% coverage, but zinc less than 1%. Today we're at around 6 to 7% coverage of that combination or of zinc coverage. When we look at the major challenges from a context standpoint globally, there is insufficient access, production, distribution, and promotion of key commodities like ORS and zinc. And so there was an urgent need to strengthen supply systems that delivered essential commodities like ORS and zinc. I will jump to the next slide here. So moving from, this kind of context problem definition phase and really kind of understanding the problem from a literature standpoint, we then really wanted to understand it from the perspective of our target audience or from an end user perspective. And so through a series of focus group discussions and household interviews, worked a lot with caregivers in rural Zambia to understand and diagnose the various problems or challenges that mothers would face, really in terms of specifying specific behaviors. So we simply asked mothers, what happens when your child gets diarrhea, and this kind of behavior mapping exercise where we really tried to understand the journey of a mother and a child when seeking treatment. And we learned a tremendous amount of information. So one, we heard about the difficulties in mixing ORS. So a mother will get a 1 liter sachet of ORS, take it home to prepare, and we did 2,400 household surveys and actually looked at how mothers were preparing ORS, and I'll show you the next slide in a moment, just the challenges and the reasons why mothers do have difficulties in mixing and preparing that ORS and measuring out the right amount of water. We also learned about the shortcomings of 1 liter sachets for home use, specifically the idea that children under 5 won't consume more than 400 milliliters on average in a 24-hour period. And within that 24-hour period is when you want to be consuming ORS, because if you wait longer than that, there's a risk of contamination. And if you prepare a liter in that context where water is often scarce, and you have young girls going out and collecting water that is being used for the household for that day, you're encouraging them to throw out potentially 600 milliliters of water.
Rohit?
Yes.
Sorry, we just have a few minutes.
Sure,
So,
I'm gonna wrap up.
thanks.
So we learned about kids not liking the taste of ORS. We asked about branding, colors, images, etc. Learned about willingness to pay. This is, we took photographs of the containers that mothers were using to prepare ORS. And you can see from this image that, a vast variety of containers. And so 60% or 40% of the time, caregivers were preparing a solution that was either too concentrated or too diluted. And so, a problem with utilization. It then moved into the design phase to address the various challenges that we saw come up and that we heard from mothers. And so We designed a container that kind of designed for behavior change, right? So it acted as a measurement vessel to mix out the right amount of water. We worked with a local manufacturer, a pharmaceutical company, to shrink down the size of the ORS sachets so that instead of a liter, there were 400 milliliters. We co-packaged ORS and zinc, which was a critical piece, so that they would both be received together, which wasn't happening previously. And we put in a bar of hand soap to kind of tie in the message of prevention and treatment, and make the kit a little bit more attractive as well. We built a value chain around the product, really thinking about value chains, creating demand at the end of the supply chain, and creating this demand pull that pulls the product to the consumer at the end of the value chain. And so value chain thinking is another kind of key theme within the course, that really where we think about the various stakeholders within the system, the various potential intervention points, a way of mapping behavior. So it's something that complements behavior mapping and journey mapping very well as also. And so this is also covered in the course and putting those things together, the product based on human-centered design, together with the value chain, along with health promotion to create demand at the end of that value chain, created a situation where we were able to increase coverage from less than 1% to 47% within a year. We were also able to increase the proper preparation and utilization of ORS from that 60% baseline to 93% using the kit, and kind of using design thinking to improve the behaviors. And then we also reduced the distance caregivers were traveling to access ORS and zinc. I'm going to pause. I'm going to stop there so we can open it up for Q&A with whatever time we have left. But I think that's a good flavor of how we applied a behavior-centered design framework.
Thanks, Rohit.
Thanks so much. Sorry for the delay on the start here.
Yeah, no problem. We did have a few questions in the chat as we were going through, and Julie has been putting some answers in the chat as well. So for those of you who have not seen the chat, you can go there. But there was the question around what are the efforts on the climate resilient WASH? So Julie's just explained around adapting infrastructure design and the governance, strengthening governance systems. As two ways to do that. There's a little bit more on that question there. Question around community ownership as well. Obviously, as we're trying to sort of, promote community ownership and not being dependent on donors. So Julie's added a little bit of an answer there around community ownership in terms of that being central to WaterAid's work, and co-design processes that we have that were used with the behavior change interventions in BASIN that Julie and Rohit are working on as well. So there's a little bit of information there, and a little bit more from Julie, but I think those were the main questions. And there was one around what immediate lessons are we learning from the Indigenous people, especially about water use and water conservation. So that one, I think Julie's just added something into the chat on that, but maybe that's a good one we could end with. Is there any lessons coming out so far?
Yeah,
Absolutely.
it's a great one. And interestingly, we were just talking about this yesterday, and we're going to be likely bringing all that information together in a paper focused on uncovering the findings from Indigenous groups, including the Barbag people in Tanzania. I think the interesting thing really is they feel like Basutu is a god to them. There's a lot of cultural, religious beliefs around the lake. So it's both a motivation to protect it, but it's also sort of a fear or a caution of intervening with the lake. and what's happening around the lake, and that maybe it needs to be left alone. And so I was trying, it's hard to sum up in a short text message in the chat, which is what I was trying to do. So there's a lot to unpack there, but again, that, I think we're getting more familiar with the fact that, water is the lifeblood in many Indigenous beliefs, and so it's a different way of thinking of it. It's not thinking of it as a resource; it's thinking of it really as part of humanity, kind of as well. And so there's a lot to understand, and where we understand or don't understand behavior change in the context of those beliefs as well. It's quite complex and really fascinating, to be honest. So that's what I can say in short form. I don't know if Rohit wants to add other points on that.
Yeah, no, I mean, this is definitely something we're looking at as well, from a epistemology standpoint, the different lenses that are brought to, relating to water, and the implications that might also have for, from a policy standpoint, so there are a couple of case study examples where bodies of water have actually been granted legal rights. And that a lot of that actually stemmed from Indigenous perspectives on water, and kind of revering the water and seeing it as a living entity. And so, in thinking about how we kind of scale some of those concepts from a policy standpoint, and really, bring these different lenses to protection of water, and thinking about water security more broadly is something we're looking a lot at right now, actually, and kind of doing that by bringing different Indigenous perspectives from around the world into our analysis, actually, right now. So that's something you can look out for, hopefully in the first quarter of next year.
Great. We will look forward to it. Watch out for that. Thank you very much. I realize we're just at the end of our hour at the moment. Thanks a lot to Julie and Rohit for that presentation and interesting findings from BASIN. We look forward to seeing more around that. Also, if you are interested in the Canadian Association for Global Health or the Climate Change and Health Working Group, you can scan the QR codes. I've also put the links in the chat. And we hope to have, more of you join the group. And there's another newsletter coming in December, so watch out for that as well from CAGH.
If there's any other questions along the way, feel free to send us an email as well.
Great. Thanks, Rohit. Thank you.
Thanks so much, everyone.
And we can stop recording now.
Good.